Hello everyone. I wanted to make sure that I go through the syllabus with you and the course learning form. So I know I talked fast in class. I want to make sure that everyone has a clear understanding. So first of all, I want to go to the syllabus, which is here. And then once you get to the syllabus, go ahead and open. It's a hyperlink right here. Hyperlink, open up your syllabus. I just wanted to point out some things to you with the syllabus. So here's our syllabus, Nursing 212 syllabus. And as I scroll up, I want to point out some things in the syllabus just to make sure that we're covering everything. This is our mission statement and our vision statement. Make sure you read this. Know that the college, what our mission and our vision statement is. Also, as I move on, here's our School of Nursing mission statement. So that's very important to know the mission statement for the School of Nursing that you're in. Make sure that our mission aligns with your goals as an individual on what you want to get out of this program. Sorry, I'm trying to move. This is the front page that I requested. You guys all have provided that to me. Thank you. Appreciate that. And then this is just a little bit about our program. Welcome to the program. Our table of contents, and then who are your lead instructors. So all your information is here regarding your clinical site and who's your lead instructors. If you need to match things up with your job, here's the clinical days that we'll go to clinical, and here's your simulation days. I try to put that in the syllabus for everyone. So here's your clinical site, your simulation days, and your clinical days. Okay. And I did update the syllabus to reflect Rancho Springs Medical Center here. As we move on, this is Mount San Jacinto Associated Degree Nursing Program. These are our learning outcomes for the program for Nursing 212. So make sure you read these outcomes, learning outcomes. So you may see PLOs, that's Program Learning Outcome. In addition to that, we have course learning outcomes. And these outcomes we are going to touch on throughout clinical, throughout theory. And notice they're the same headers for your journal. You have the nurse role leadership, you have nursing process, patient-centered, communication, evidence-based practice, quality improvement, safety. This is the calendar that will be adjusted throughout the 9 weeks, just in case if things happen like how we changed the dates earlier. I wanted to point out in the syllabus, I did put this little blurb here so everyone would know. So faculty reserve the right to make necessary changes to the syllabus as the semester progresses. Every attempt will be made to minimize the inconvenience to the students in the event of a change to the syllabus. Students will be notified of changes via class announcement, Canvas, and accompanying email notification in a timely manner. Faculty appreciates your understanding. On this page is your course learning outcomes. You have 26 for Nursing 212. Please pay attention to all of them. And as you see, these are the things that you need to have learned before moving on to Nursing 214. On this page is the student responsibilities. Please read the student responsibilities. Look at the things we have in bold that really stands out. The student's responsible for checking the MSJC email a minimum of 3 times a week. Okay. Make sure you read this whole entire section. If you have any questions, especially with the strategic plan for success contract, please come to me and let me know about your questions. Here are my office hours, 9 to 2 on Wednesday. The attendance policy is very important. Look at the tardies and look at the absences. 2 tardies in a theory will be counted as 1 absence. So the first week, for those who came in late, I didn't mark anything as we were trying to adjust to our new role as a student nurse. But moving forward, if you're late, you will be marked as a tardy. And remember, 2 tardies equals an absence. Read under here for what absences entails and what makeup entails. Okay, so it's all in your syllabus for attendance and especially your professional expectation. Different methods I'll be using and evaluations and so forth. Also, you have your examination policy here. I know someone was asking me about the percentage, and it's right here. Student must maintain 75% average at all times on course examinations. If a course exam grade falls below 75%, the student will take the following steps. And look at these steps. We're putting the responsibility back on you. Now, I have told you that my class is a little different as we do use our laptops and our cell phones in our class. But keep in mind, we're using that, but we're not using them to do any text messaging or emailing during class time. We're using them to enhance our learning. So please be respectful of that. And also academic dishonesty. So I am aware about how I give tests online, and I am aware about the quizzes that I give that goes home. So you have to start being ethical. We're the #1 profession, trusted profession. So being ethical is very important. And I understand about screenshotting and all those other things. So when we do tests online and when we have to use our own personal computers, I will be monitoring for any potential screenshotting of the screen when taking a test. All your papers and projects that are due, please pay attention to this. 10% reduction of points will be accrued for any late paper, quiz, or assignment. These are not my rules. This is the rules of the school. So please do not email me saying, oh, I'm sorry that it's late. Can you not give me the points off? It's the rules of the college, not Professor Roberts. I would highly recommend for you to start reading about guidelines for the concept map. It's a big concept map that you have due. It's worth a lot of points. There are several pages in your syllabus that will tell you about how to do your concept map. Also, I'm going to start bringing this in to our studies as we already start doing assessment and intervention on day 1. We're going to keep doing it, okay? Just pay attention to, it's going fast, but you can always pause this. These are all the things that are needed in your big concept map. Very important to start reading those pages and getting it done, okay? And you do have a teaching project. So your teaching project will be due. Also, make sure that you have references from where you get your information. Make sure your references are in APA format, and pick a teaching topic. Some students have already come stating that they want to choose a certain topic. Just respond to that area so I will know, and I will start gathering up the list and seeing. I don't want any topics duplicated in the same clinical setting. Now I want to try and have everyone do a single topic. Get your partner, but if not, if you're in a different clinical setting, then you can do that same topic that someone else has. Okay? So I'm sure you guys now you have been introduced to ATI. You will have an ATI exam in Nursing 212 called Fundamentals of Nursing A. It's a big exam as if you were taking the state boards. So this will let you know how ready you are to move on to 214 and how ready you are as in obtaining all the information. And this will give you a predictability on how you would have done if you were taking state boards tests in this particular area. This is our grading plan. So make sure that you look at the grading plan. Okay. You still have 20% of your grade is worth is doing clinical. So the paperwork that you have due, the projects that you're going to present in clinical, the nursing assessment, those things are all part of your clinical paperwork. And in theory, of course, we have our quizzes, our vital sign quiz, our nurse term quiz, and then 5 other quizzes sporadically throughout the semester that I will provide for you. Also, with your exams, you have 3 exams. Each one is 60 points each, so I make life easy. Each question is worth 1 point. Okay, but as you notice, your final exam is worth 100 points. So each exam is worth 60 points each, which means that you'll have 60 questions on each exam. And so forth. You can see down here for the clinical component, you have the concept map, your physical assessment, skills checklist, and also your clinical paperwork. Your total amount of points is 500, so you can start calculating your own percentage on if you're going to obtain an A, which I'm sure you all will, or a B or a C. Here are our clinical expectations, and please read this area down at the bottom. Is very important. This page covers some reminders for clinical practice. You can scroll to see the remaining pages. Okay, this is a small paragraph but very mighty. It's regarding simulation. Please read the 10 elements, the critical behaviors prior to every procedure. This is called a quality assurance form. You can obtain these forms at the front desk. This is what you bring every day to clinical. Put your name on it, what semester you're in. You have to write down 3 objectives with a rationale. Show the nurse or the instructor what your objectives are, and then try to get someone to sign a comment for you. This is really good for resume also. This is your own personal objectives, what you want to accomplish during clinical that day that aligns with what you're learning. Highly recommend for you to read the criteria for unsafe clinical behavior. May include but not limited to the following. So make sure you go through all of these, okay? Very important. So how do you know how you're doing in clinical? This is your evaluation tool. So it's right here in your syllabus. There's nothing to hide. So you know what you're being evaluated on. So if you pay any attention, it's still with our 7 core values. Nursing role, nursing process, patient-centered care, communication. So we put our 7 values in almost everything that we do at Mount San Jacinto School of Nursing. So you can't say, I never knew about these values. They're always there. I didn't point out the critical elements, but they are in your syllabus. Please read that. Now this I'm going to go over very briefly. Now these are your modules, and basically in a nutshell, like a summary of your entire modules is right here. So these are all the summaries of what module 1, 2, 3, 4, 5, 6, 7, 8, and 9 is about. And then as I'm scrolling through fast, these are the study guides for different ones. Here it says 1.2 up here, so you can see the different study guides. This is I wanted to show you how to read your study guide to help you with your reading better. Now, required readings, I put the name of the book and the chapter. Okay, over here, this is your outline. This is what you should be reading in the chapter: the meta paradigm, nursing, patient, environment, health, and nursing. So know what these things are. Conceptual framework, know what they are. This is your study guide to your reading. So make sure you look on your column, suggested learning activities. Your chapter is included in there also. And then, like, what am I supposed to read in this chapter? You look over here at your objectives, explain the purpose of nursing, and you see what your objectives are for that. So it goes on and on for each one. So now you know how to read this. You read over here what book you need to read, what's your chapter, We're going to present this material in lecture in PowerPoint, and here's your objectives of what you need to learn from that particular chapter. I hope that helps by explaining that. Don't worry, over here, we're not going to do any role playing. Your clinical objectives is what you do in clinical environment. I hope this was helpful for you. If you have any questions, feel free to come to me during office hours or send a message through